On June 22nd, you always remember the day, I knew I was waiting for the call, and I was actually getting my hair done. I was getting a blowout at the salon before an event that evening, and I received a call from my doctor, and I asked, the hairdresser, could I go to the other side and take the call? And I knew something was wrong when the radiologist, who I've known for a while, opened with, well, I have the results, but first of all, how are you doing? And I said, I know her well enough to know she would open with the good news. Mm-hmm. And I found it odd that she wouldn't say the C word. She didn't say cancer. And finally I said, will you just say it? And I'm sitting in the back room where they normally do the treatments, just crying. Mm-hmm. And after I hung up with her, I called my 2 best friends and told them the news. And initially I had planned to just go be with my 3 best girlfriends and cry. Mm-hmm. One of them was actually recouping from surgery that week, so we were all going to go over to her mm-hmm. place to make it easier since she couldn't yet travel. Mm-hmm. And I had canceled plans to meet the man I was dating at a bar for a charity event.
We're now at the Sibley Cancer Center where you'll be starting radiation on Thursday.
Yes.
How do you feel being here?
This is always a safe place for me, even when there's medical procedures going on. I've worked with one of the doctors. She's a breast surgeon, and that's a doctor that's devoted to breast health, breast cancer issues, and that's exclusively her practice area. And I've worked with her since I was 26. And I found my first lump, and back then I was very scared. It was 2 years after my mom had died of cancer, so I was still processing the emotions from that. And 11 years later, we have such a great working relationship. I feel comfortable coming here. I'll walk through the halls. I'll see technicians and assistants and nurses and doctors that I know and that I care for, and I also know that they care for me. Mm-hmm. And I describe Sibley as a kinder, gentler hospital, mm-hmm. and that's the experience that I've had. So although you're never psyched to have a diagnosis like this or have to require surgery, I know I'm in good hands.
Sounds like you have a lot of trust in your doctor.
Yes, and I think that's very important. Whatever your issues are, even if you're just going once a year for your annual checkup at a GYN, or you're going to student health to make sure do you need antibiotics for a cold or a flu, it's important to have trust. And sometimes that needs to be earned a little bit. And sometimes you have to be your best advocate. And that's tough. We're taught to trust doctors and take their word as the authority, and most of the time that's the case, but if you feel like something's wrong with your body or you need care that you're not receiving, it's your right as a person and as a patient to ask for it.
What about symptoms on your sex life? Let's take it back in the bedroom. Radiation and sexuality. Any ideas?
I hope it's not as bad as chemo, mm-hmm. but you don't know how bad the fatigue is going to be. Mm-hmm. Burns. I'm concerned about my appearance. I like it the way it is. Mm-hmm. And if there's burns on my breast, that's not something I'd feel great about, but I think it's about communicating, and I think it's about stating that it doesn't need to make me feel uncomfortable, and it doesn't need to make my partner feel uncomfortable. Mm-hmm. But as long as we're open about it and we're discussing it, and thankfully the man I'm dating every step of the way, he's been a part of things.
Can you walk me through what chemo's like?
Okay. On chemo day, you arrive here, you meet with the doctor, and every office will be different, but then you receive whatever the protocol is. And for some people that could be 1 bag, and for some people like me, that could be 5 or 7 bags. So I was here 6 hours a day when it was chemo day. But thankfully I'm in a great office, and I'm blessed to have the insurance I do, and it's sunny here, as you can see, and there's plants and people are interacting. We're taping in the chemo room, so it's not your typical, you're just in a quiet,
sterile
dark
room.
Right, exactly. They have better Wi-Fi than your local Starbucks, so a lot of us would be on the computer. We go and we get lunch. I did 2 photo shoots in this room. So you socialize. We just met a woman who's 91, mm-hmm. going through chemo, who wants to live to be 100.
Now today, this IV that you're getting, this is not chemo?
Correct.
Okay.
The aggressive strain of breast cancer is hormone resistant. So most women, when they finish treatment for breast cancer, require 5 years of hormone therapy. Usually just a pill you'd be taking every day. My breast cancer is hormone resistant, so I need 1 bag of IVs every 3 weeks for a year.
Mm-hmm.